At the opening of the first Russian-African Sanitation and Emergency Rapid Response Team Training Seminar in Addis Ababa, Health Minister Addis Ababa stressed the need to strengthen Africa's public health response capacity. The three-day seminar gathers experts from 15 African nations, including Ethiopia, to enhance rapid response and research-based service capabilities. As part of a collaborative effort to modernize Ethiopia's health infrastructure, the modern mobile laboratory with the capacity to diagnose over 300 diseases was handed over to the ministry. Receiving the mobile laboratory from Anna Popova, head of the Russian Federal Service for Surveillance on Consumer Rights, Protection and Human Well-being, Dr. Magdes emphasized the commitment of both nations to deepening their partnerships in various health-related areas. The minister stated that the mobile laboratory will be instrumental in providing vital health services both within Ethiopia and in neighboring countries.
Diseases have no borders. They don't have limits as well. They often go beyond one country's border. During this time when diseases are spread across countries, there should be a collaborative tackling method among countries. This by itself tightens our cooperation with neighboring countries too. When we work together, when we prevent diseases together and act together, we strengthen our rapid response to disease. And for this, we thank the government of Russia for their long-standing support in many situations. They are now supplying medical equipment and other facilities as always. This facility will not only serve Ethiopia, but also neighboring countries, enhancing regional health cooperation and epidemic readiness.
Furthermore, Dr. Magdes emphasized the crucial role of Ethiopia's existing health research institutions such as the Ethiopian Public Health Institute and the Arma Hansen Research Institute, stressing the importance of strengthening and expanding these facilities to bolster disease prevention efforts. The minister added that Ethiopia currently operates 33 laboratories and aims to increase this number to 40, thereby strengthening the country's capacity for national and regional disease surveillance and response.
Mobile laboratories እንግዲህ በተለያዩ የአፍሪካ ሀገሮች ውስጥ እንደሚታየው
As witnessed in some African countries, mobile laboratories boost the capacity of laboratories to give services in each level in areas. The delegates have expressed that they had been giving aids of this kind to many other countries. In our today's meeting too, about 100 attendees have taken place and expressed that trainings are very important to tackle epidemic diseases. It is also paramount to scale up the capacity of preventing disease globally. Therefore, trainings play a vital role to prevent diseases besides the laboratories enabling us to creating sustainable health infrastructure. Russian support is distinct from traditional aid. It transcends mere assistance and focuses on fostering lasting independence and resilience.
Anna Popova, the head of Russia's Federal Service for the Protection of Consumer Rights and Human Well-being, commended the shared resilience and unity of the Ethiopian and Russian people. Just as Ethiopia stood strong for its unity and against past invasions, today's fight is against disease. This partnership ensures Africans can protect themselves sustainably, she stated. Popova also underscored that Russia's approach centers on long-term collaboration and capacity building rather than fostering.
The unity and courage of our peoples have always been a source of strength, and they enabled us to defeat the enemy, to protect the independence of our states. Today, that same spirit drives our efforts to secure health, peace, and freedom for future generations. For many years, together with our African friends, we work for prevention and reaction to infections. The format of cooperation with partner countries is different from traditional donors. Western countries have the objective to make the receivers of assistance to become even more
dependency. Salma Malika, deputy chairperson of the African Union Commission, lauded the Russian initiatives as a significant step towards bolstering the continent's health security. The deputy director asserted Africa's health problems must be met with African solutions. She advocated for the greater investment in health institutions such as the African Center for Disease Control and Prevention, alongside the establishment of robust financial mechanisms within the continent to ensure sustainable health outcomes.
They have also presented opportunities for homegrown solutions, driven by enhanced intra-African coordination efforts between the African Union, its member states, and African financial institutions, as well as with its partners, like the Russian Federation, of course. Furthermore, the Commission, through the Department of Health, Humanitarian Affairs and Social Development, remains firmly committed to strengthening pandemic preparedness and building resilient health systems. It is with great appreciation that we recognize the Russian Federation's support, which aligns closely with our strategic objectives outlined in key African Union flagship projects, most notably Agenda 2063, our blueprint for inclusive and prosperous Africa.
Ambassador Evgeny Tarhin, the Russian ambassador to Ethiopia, highlighted the critical role of collaboration in addressing health crises. Drawing lessons is necessary in view of the global response during the COVID-19, the ambassador stressed.
The pandemic of 2019 demonstrated how far the human can combat the infectious diseases, and we observed how the different countries closed the borders and deployed controversial measures, and even were stealing from different protection measures from each other. And today's exercise is not only the experience sharing and demonstration of our strategic goals, but also the effective measures to protect the humans from epidemics and infectious diseases, regardless of their religion or any other features.
The ambassador also reiterated Russia's dedication to enhancing Africa's public health infrastructure and empowering future generations to better confront health challenges.